The bone marrow transplant costs anywhere between 60 to 450 million shillings in India, which provides fairly reasonable fees for complicated medical procedure compared to other parts of the world. This transplant involves destroying the sickle cell infected bone marrow through chemotherapy and replacing it with a healthy one. This is the only way of treating the condition. But Program Manager of the Non-Communicable Diseases in Ministry of Health, Dr. Gerard Mutungi, cautions against going for this procedure.
Bone marrow transplant is a complicated procedure. It's not something that we are going to advocate for everyone. First of all, you must look for a compatible donor, and that's not easy. And even when you get a compatible donor, they must first destroy your bone marrow before they transplant the other one. And there could be many complications, including death. So a few cases have actually had the bone marrow transplant, and they have cured, but that is in very specialized centers. We have the drug that we call hydroxyurea, which is like, I can define it as a disease-stabilizing drug. And the people who take hydroxyurea, they have less painful crisis, they need less blood transfusion.
Sickle cell anemia is a hereditary blood disorder where red blood cells assume an abnormal rigid sickle shape. This reduces the flexibility of the cells to move in the body and could lead to various complications. At least 25,000 babies are born annually with the condition, many of whom die as infants. Studies show that 20% of the Ugandan population, approximately 6 million people, could bear a child with sickle cells. The Bamba in Bundibujo district are the most prone to sickle cell.
I think it is the genetic composition. We have not clearly studied why they have that gene, but sickle cell gene is generally common in malaria endemic areas because carriers of sickle cell tend to survive malaria death than normal children.
There have been complaints of a few centers to test for sickle cells, but the health ministry says they are available. The Mulago Hospital Sickle Cell Clinic receives 40 to 50 patients daily. Of these, 8 to 9 get admitted in critical condition. The clinic has 9,000 registered patients.
It's not true that we have one sickle cell clinic in Uganda. Yes, Mulago Hospital Sickle Cell Clinic was the first and it's still the biggest. But we have since then started other sickle cell clinics. There is a sickle cell clinic in Mengo, there is a sickle cell clinic in Rubaga, there is a sickle cell clinic in Zambia, there is a sickle cell clinic in Imbarara, and other regional referral hospitals.
Government is looking at strengthening its partnership with private not-for-profit health service providers to ensure that those living with the condition get adequate treatment.
We want to formulate NCD policy, that is non-communicable diseases policy, and sickle cell is one of them. And we are going to make sure that all regional referral hospitals have HB electrophoresis machine which can confirm that somebody has sickle cell disease.
Humanity have pleasures and pains.
On Wednesday, Ministry of Health will join Uganda Sickle Cell Association and other activists to commemorate the World Sickle Cell Day at Kasana Town in Luwero District, with the main aim of raising awareness on the condition. NBS Television has also partnered with the Uganda American Sickle Cell Rescue Fund and other partners in organizing the first sickle cell conference here in Kampala on Thursday. Sickle cell anemia has been described as a neglected condition, but a test with your partner before marriage can save you a lot. Even then, the condition can be managed with proper information. Zahra Namuli, NBS Television.